Welcome back. New York has turned the corner in the pandemic. That much seems to be clear. It has one of the lowest infection rates in the United States and, of course, is now well and truly into the phased reopening plan. The whole state is now being reopened slowly but surely. And the New York City, of course, remains in phase one until July. The governor has touted the state's progress.
We have the lowest number of hospitalizations since we started. Amen. And we have the lowest number of deaths since we started. Once again, same numbers yesterday, but on the 3-day average, we are at a new low. And you want to talk about congratulations and something to celebrate. That is something to celebrate.
How to get around the city? Well, the New York City MTA, Metropolitan Transit Authority, has paid a severe price during the pandemic. Look at the numbers and you'll see what I mean. Subway ridership is down more than 82% from this time last year. The authority is projected to lose $7 to $8.5 billion in the course of the year and will need federal help. But this is the most telling of all. More than 100 employees, 123 employees, have lost their lives. Now, getting the whole thing going again is not easy. It's one of the world's biggest public transport systems. They have to sanitize roughly 8,800 subway cars and buses every day. And they do so, of course, they've got to keep 472 subway stations open and safe. And there are roughly 2.5 billion journeys being made. So, putting this into perspective, the MTA is now seeking nearly $4 billion more in federal support to help breach those numbers. Pat Hoye is the agency's chairman and chief executive. Joins me now. Pat, thank you. First of all, before we even talk about anything, let me, I suppose, condolences and thoughts at the number of people that have been directly related and who've lost their lives, the subway and the bus drivers and those who work in the stations who lost their lives helping to keep essential workers on the move. It is a terrible toll.
Richard, it is a terrible toll, and you're quite right. They were heroes moving heroes. During the pandemic and continuing, our employees on subways, buses, Long Island Railroad, Metro North are moving doctors, nurses, firefighters, police officers, utility workers, their colleagues as transit workers, those working in pharmacies and groceries. Extraordinarily important work. Good news is that nearly 10,000 of them have returned to work after having been on home quarantine. Some of those infected by the virus, most of them quarantined because they had contact with someone who was, and that's good news.
Pat, if you don't get this money from the federal government, what will it mean?
Well, look, just to be clear what we're talking about, we got $3.8 billion early in the year from the so-called CARES Act. The HEROES Act, which Speaker Pelosi passed with support from the New York congressional delegation, and Senator Schumer, is an additional $3.9 million. That will close our operating gap for 2020. One of the reasons that the gap is so high is that, first, New York is the epicenter of the pandemic in the United States. Point one. Point two, our ridership is so high. When Governor Cuomo put New York on pause, our customers, like all New Yorkers, listened and stayed home unless they were first responders or essential employees. And the other reason why the gap is so high is because New York's fare box recovery, the amount that our customers pay, is so, as a percentage, greater than other transit agencies around the country. So the financial toll has been significant.
But it all comes down to, at the end of the day, at some point, either the worry of a cut in services or a hike in fares. Do you see either of those possibilities, maybe even both of them, becoming necessary in the next 12 months?
Well, Richard, getting the second chunk of federal money is absolutely essential. If we're able to do that, the $3.9 billion provided in the HEROES Act, that will deal with our operations during the course of 2020. And then, of course, we'll have to deal with 2021. Happily, ridership is, we've increased service a week ago. Ridership is today 380,000 riders higher on subways and buses than it was the Monday before we increased service. So New Yorkers are returning. 380,000 customers is actually the size of a small, respectable transit agency. It's by MTA measures, those are low numbers, but riders are coming back, and riders returning to the system is going to be fundamental to the economic recovery of the New York City, the New York City region, and the MTA.
Right, but as they're discovering, as London Transport, of whom you will be very familiar, is discovering with the tube, which, you know, the trains aren't as big, so it crowds more easily, but they're seeing crowding, some crowding on the tube, which raises issues of safety. Now, you're some way off that at the moment, but if you do get large numbers coming back, then you do have that same problem, don't you?
Well, I'd suggest it's a different problem, Richard. One is we've been candid with our customers throughout, before the pandemic, during, and after. Second is the most important thing that our customers and employees can do is masks, masks, masks. Governor Cuomo has made the wearing of masks on transit a state requirement, a state law requirement. 100% of our employees are wearing masks. We did a physical study about 10 days ago, and that reported 92% mask compliance by customers. We did it again this week, and we're now up to 95 is the latest data point. So a combination of increased service, masks on all customers and employees, and we have wayfinders and platform controllers and others that are monitoring that. Last week, we distributed about 2 million masks to returning riders who didn't have them. We're distributing hand sanitizer. The research clearly indicates, and we've been candid with our customers about social distance. Social distance of 6 feet is not possible on mass transit, hence the name mask. And our colleagues at TfL in London are experiencing the same thing. So what we are telling our customers is the truth. You've got to wear a mask. Your co-commuters have to wear a mask. Employees have to wear a mask. We're going to disinfect every subway car, every bus, every Long Island Railroad and Metro-North car multiple times a day in the case of the subways. The stations we're disinfecting twice a day. If customers wear masks, we will continue the disinfecting regime, of course. We're also piloting 2 innovative disinfecting programs, which should give customers additional assurance, which is one, an ultraviolet C light project. We were the first, working with a Columbia professor, Dr. David Brenner, to indicate that the COVID-19 virus is killed by ultraviolet C light. And we're also piloting antimicrobials, which we've applied a number of times to our subway cars and buses, which we believe, and we're waiting for independent labs to verify this, will kill the COVID-19 virus and do it for weeks and months after application.
Pat, it is good to have you. Thank you. You're an extremely busy man. I'm grateful you gave us time. Let's talk more as the summer moves on, and we can work out exactly where we stand at the moment. Thank you, sir. Now,
Look forward to that, Richard. Thanks for having me.